Hi, I'm Dr. Lori Brotto, a professor of gynecology at UBC, and we're here today to talk about sexual health in breast cancer survivors, a new project that we call the Breast Study. The good news is that survivorship rates with breast cancer are at an all-time high. However, there are some lasting quality of life changes, such as sexual health, that many breast cancer survivors face. For example, many of them will describe pain with sexual activity, reduced interest in sex, and changes in body, mood, and anxiety that can create a lot of distress for them. And so that's why we're doing the Breast Study, which is a study comparing two effective psychological interventions for survivors of breast cancer. Briefly, women will take part in online sessions that will involve either practicing mindfulness meditation or receiving information and education about their sexual health. The sessions are entirely online over a period of 8 weeks. The reason why we're looking at mindfulness specifically for sexual health in breast cancer survivors is because over the last 15 years or so, there's been a lot of evidence showing mindfulness to be effective for improving sexual desire, reducing genital pain, and improving overall quality of life in other populations of women. It might be especially useful for breast cancer survivors because it addresses many different domains of their biological as well as psychosocial health. The other arm involves talking about sexuality, providing information and education, and really drawing upon the other group members to provide a supportive environment for women. And we know that this sense of support and feeling validated and feeling normalized can be very therapeutic to improve sexual function. So we are comparing two effective treatments, and what we're most interested in is being able to evaluate which women respond most positively to which treatment. So in addition to attending each group session online for 2 hours, we have a number of homework exercises that we invite our participants to do before the next session. So in the mindfulness arm, we do invite women to practice a mindful meditation every day. And in the sex therapy and education arm, there are a number of other exercises such as communication and body awareness exercises that also take place between sessions. A lot of women with sexual health concerns never reach out and talk to a healthcare provider, and instead they suffer in silence. One of the advantages of being able to participate in a group intervention online is that women express a sense of safety and privacy because they can take part in the sessions in their own home. That said, it's very important that you honor where you're at and listen to your inner self to guide whether this may or may not be the appropriate time to participate. We do invite you, however, to reach out and find out more about the Breast Study and see if it's a good fit for you. There's considerable evidence that skills-based approaches, in other words, having women practice exercises at home on their own, can be one of the most powerful ways of cultivating sexual desire and reducing genital pain in women. And so through the groups, we will provide women with these exercises that they can take with them, not only as they're participating in the group, but as they continue on their sexual health journey. So to find out more about the study, check out the description box. You can also find out more about the research taking place in UBC sexual health research at www.brottolab.com. Thanks for listening.